Welcome to the Cystic Fibrosis Foundation CF Education Day, Cystic Fibrosis Related Diabetes, Daily Management. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. This webcast is hosted by the Foundation and supported through an unrestricted educational grant from Genentech. To hear more about cystic fibrosis-related diabetes, diagnosis, screening, and what to do in illness, please watch an archive webcast on the Foundation's website. This webcast will answer questions related to the daily management of CFRD, nutrition, insulin, monitoring your blood glucose levels, exercise. These are the kind of questions that will be asked and answered. However, questions that do not relate to the topic or that ask for medical advice will not be asked or answered. If you have questions, I strongly encourage you to talk with your doctor and staff at the CF Care Center to learn more. Also, if you wish, you can contact the Cystic Fibrosis Foundation at 800-FIGHT-CF or info@cff.org. Joining me to talk about daily management of CFRD and what people with CF and their families should know are Dr. Antoinette Moran and Carol Brunzell from the University of Minnesota. Tony is a professor and the division chief of pediatric endocrinology at the university. She's also the leading expert and researcher in the United States on CFRD and was the co-leader of the 2010 Cystic Fibrosis Care Guidelines for CF-related diabetes. Carol Brunzell is a registered dietitian and also a certified diabetes educator. She's spoken to many healthcare professionals related to CFRD and was also a part of the development of the CFRD care guidelines. Both Tony and Carol are also the co-authors of the 5th edition of Managing Cystic Fibrosis-Related Diabetes, an instruction guide for patients and families that's available on the Foundation's website. Welcome, Tony and Carol. So the first question I have about managing diabetes daily is, when should people with CF-related diabetes, so they have a diagnosis, when should they test their blood glucose levels?
So anybody on insulin should check their blood sugar at least 3 times a day. The most common time to test is before meals, because then you can decide if you need to take a little extra insulin if your blood sugar happens to be high. But we also ask people to occasionally check 2 hours after meals so we can make sure their meal dose is right, and to check occasionally in the middle of the night to make sure they're not dropping low at night, to check after vigorous exercise.
So on monitoring, what is a hemoglobin A1C? And I've heard that it's not an accurate test in cystic fibrosis. What does that mean? What is it, and what's it mean for CF?
So we all have red blood cells, and sugar or glucose sticks to that red blood cell over its lifespan, which in most people is about 3 months. And so the amount of glucose sticking to the red blood cell is an average measure of what blood sugars have been over the 3-month period. And in type 1 and type 2 diabetes, it can predict risk of eye disease, kidney disease. The problem in CF is that the red blood cells, just because of inflammation, turn over more quickly and don't necessarily live 3 months, and that falsely lowers the hemoglobin A1C. So you can't compare the hemoglobin A1C in someone with CF to the hemoglobin A1C of someone with type 1 diabetes or type 2 diabetes. What you can do for an individual patient is just see the trends. You know, if my hemoglobin A1C is higher this month than it was last month, then my blood sugars have been higher and maybe I need more insulin.
Two things. Number one, we need to speak up just a little bit more so our microphones can work. That's okay. But can CFRD be controlled with diet or pills? So a person with CFRD, they won't have to take insulin? Or are they, once they have CFRD, insulin is the recommended treatment?
Once they have CFRD, insulin is the recommended treatment.
Okay.
So the pills just don't work. Pills help your body use insulin better, but the main problem in CF is that they are deficient in insulin in the same way as they're deficient in vitamins. no one would not replace vitamins in CF or wait until someone actually had signs of vitamin deficiency. If insulin were not so difficult to give, and really it's a perceived difficulty, if insulin didn't have to be given by injection, if people weren't afraid of it, we'd probably start everybody on insulin. So think of it less as what can I do to control my blood sugars by not eating so much, by exercising. Think of it as insulin, that hormone that I need to keep my muscle up, is missing in my body, and I have to replace it.
So what are the different ways that insulin is given?
There are a lot of different insulin regimens. There's not one that's better or worse than the other. It's just whatever works best for a given individual, personal preference. Here's a picture of insulin pens. So insulin can be given by injection with pens with very, very, very tiny needles, much, much smaller than the needles for blood drawing or a flu shot or IVs. Or there's insulin pumps that a person can just change every few days and just push buttons to deliver the insulin. So there's different ways of doing it.
So someone wanted to know about needing a basal therapy. Will their pancreas stop producing any insulin that they'll have to have basal insulin? Talk about the different insulin therapies and what a basal therapy is.
So all of us, whether or not we have diabetes, need some insulin around just in the background all the time, and that is basal insulin. And every time we eat, we need extra insulin to cover the food, and those are the boluses of insulin. So there is basal insulin, which can be given by a once-a-day shot of a long-acting insulin, or an insulin pump just dribbles insulin in constantly. There's meal coverage, and Carol's going to talk more about that, but it's I'm going to eat this much food, I'm going to give myself this much insulin to cover the food. And then there's something called correction or sensitivity, just because we don't do it perfectly. And if we test our blood sugar before we eat and it's a little high, we're not only going to want to cover our food, we're going to want to take a little extra. So there's three components: basal, meal coverage, and correction. And most CF patients are on all of those.
So what should a person with CF-related diabetes know about insulin?
So the more you test, the more you match your insulin to your food, you will feel better. Your blood sugars will be under better control. You'll have better energy. You'll be able to keep your weight up. So yes, that testing, that monitoring is a bit of a bother, but it's what tells you how much insulin to give or reassures you that the insulin you're giving is the right dose. You will feel better. You'll be healthier. It's worth it.
Well, that's good to know. Someone wrote in and she's like, her niece has type 1 diabetes and is on a very strict diet. Why is there a nutrition difference between type 1 diabetes and a strict diet and CF-related diabetes?
So I'll hand that over to Carol.
Great. Well, the nutrition recommendations are very different for people who have CFRD versus people with type 1 or type 2 diabetes. Mainly, the difference is because people with type 1 and type 2 diabetes have a 2 to 4 greater incidence of heart disease and stroke just by the very nature of having type 1 and type 2. Whereas with CF, there has not been one documented case of anybody ever having heart disease or dying of cardiovascular disease. For that reason, then there's certainly not a fat restriction or a sodium restriction. So the most important thing to understand is the usual CF diet does not change at all once you have been diagnosed with diabetes. It's very important, again, that people work very hard to maintain a healthy weight and good nutritional status by eating a balanced, high-calorie, high-salt, high-protein, and high-fat diet. So that doesn't change. So again, the most important part of CF with regards to just overall health and survival is maintaining that healthy body weight in order to maintain good lung function, etc.
So someone wanted to know, what is the effect of refined sugar on people with CF-related diabetes or on CFRD treatment? You know,
Right.
like the white sugar, or, you know, or soda pop.
Sure.
You know.
So based upon evidence of, by an analysis of many studies that have been done on various different types of carbohydrates and how they affect blood sugar in people with diabetes, sugar does not raise blood sugar any more than equal amounts of other foods that contain carbohydrate, and sugar is just another carbohydrate. So basically we just count the total carbohydrates and not necessarily the type. However, certainly sugar, as we all know, doesn't provide any nutritional advantages. So in the context of a healthy CF diet, sugar can be consumed.
So for someone who has CF-related diabetes, maybe for a snack, instead of going with high sugar items, it may be better to look for high fat, high protein snack foods for people to work. Would that be reasonable?
Well, I don't think that's necessarily an accurate comparison, because it isn't just sugar versus protein or fat. When we talk about carbohydrate, which yes, people with CFRD needing insulin are going to require an injection of insulin every time they eat something with carbohydrate. There are many healthy sources of carbohydrate that they can choose from, for a snack. They certainly can have protein and fat as well, which don't raise blood sugar. But when we talk about how food affects blood sugar, basically all foods have calories, and calories come from the nutrients in foods, which are carbohydrate, protein, and fat. Only carbohydrate-containing foods actually break down into blood sugar during digestion, therefore they raise blood sugar or blood glucose. Protein and fat don't affect blood glucose. So in that snack example, if someone were to choose something like a cheese stick or a beef stick or something, probably they wouldn't need insulin. But those snacks get a little old after a while, so it's nice to be able to have flexibility and variety. So I don't necessarily recommend that.
So what are the foods that have carbohydrates?
So carbohydrates are found in almost everything. All grains and grain products such as breads, rice, cereal, pasta. Certainly whole grains are a little better choice, but the carbohydrate is about the same. All fruits have carbohydrate, whether or not they're fresh or canned or dried fruit or fruit juice. Starchy vegetables in particular have the most carbohydrate compared to every other vegetable. So those would be corn, green peas, potatoes, any kind, and winter squash. Milk and yogurt have carbohydrate. Legumes, dried peas and beans like kidney beans, black beans, lentils, etc. And of course anything made with sugar, which are all desserts, sweetened beverages, snack foods, etc.
So how does somebody know they're in the grocery store? How do they know how much carbohydrates some food contain?
Okay, so one way is to look at a food label, and all of the labels are uniform in the way that they're laid out. So once you train your eye to see a couple key issues here, or serving size and total carbs, it becomes pretty easy to read a label. So the first thing you want to look at right under the nutrition facts will always be the serving size, and it's expressed both in a household measure, such as in this example, half a cup, or in a weight. So typically in our country we don't weigh food, so we go by more household measurements. So look at that household measurement and then go down to the total carbohydrate. So in this example there's 13 grams of carbohydrate in one serving, which in this example is a half a cup. That total carbohydrate includes the amount that come from sugar, so the 3 grams from sugar are included in the total of the 13. So you wouldn't need to look at the sugar separately.
So is there a ratio or an exchange, carbohydrate grams correlation?
Yep, there's a couple different ways to count carbohydrates. More recently, since food labels have become, appeared on packages in the mid-1990s, it's easier to count in grams of carbohydrate because that's what all the food labels list the carbohydrates in. However, there's another way to count carbs or carbohydrates that have been around since the mid-1950s, and that's basically what I call a shortcut way to count carbohydrates, and that can be listed depending upon which education material you're looking at in exchanges or choices or units. So basically 1 carbohydrate unit or choice or exchange equals about 12 to 15 grams of total carbohydrate in grams on a food label.
So how did the number of grams of carbohydrate correlate to using insulin?
So that will vary from one person to the next. This is what we call an insulin to carbohydrate ratio. So when a person is taking insulin, and particularly the insulin regimen such as Dr. Moran just described, where you have your basal insulin, then insulin for both your food as well as correction if you need it. That's a particular type of insulin called a rapid-acting insulin, and it starts acting within 10 to 15 minutes after you take it. So there are 3 companies that make it, but basically it's either Novolog, Humalog, or Apidra. And that dose of insulin, of these insulins, will be based, again, upon a certain amount of carbohydrates that a person is about to eat. A common starting point is 1 unit of insulin for every 15 grams of carbohydrate for adults. Younger children may need less, and some people may need less. It really depends. You start somewhere that seems reasonable if this is all new, and then you adjust according to the blood sugar results.
So they may not always be 1 unit of insulin per 15 grams of carbohydrate.
Exactly. There's a wide variety there. Yep.
So, do you have an example of counting carbohydrates for a meal?
Yep. So as you see here on the chart, this is an example of a breakfast that someone may eat. So a cup of whole milk, which will give you 13 grams of carb, and on the right is the carb units, so the shortcut way. A cup of cereal, about 28 grams of carb, a banana, 27, a couple slices of toast, 32, margarine would be 0, eggs would be 0. So the total for that meal is 100 grams of carbohydrate, which if a person was taking 1 unit of rapid-acting insulin for every 15 grams, they would need about 7 units of insulin to cover this meal.
So are Scandy shakes okay for someone with CF-related diabetes?
Absolutely. Anything that a person likes or tolerates or has been prescribed can be used. Anything can be covered with insulin, so there's no restriction on what type of supplement or tube feeding would be used.
Is there any record keeping that is helpful for people?
So certainly when people are first diagnosed and we're trying to figure out exactly what their insulin doses would be after an initial dose of insulin will be prescribed, we recommend that they keep about 3 days of food records, which as you can see here, would ask them to pretty much put their diabetes under a microscope. So you're listing the time, your type of insulin, your blood sugar, pre and 2 hour post meals, the amount of food, type of food, and the amount of carbs. So we would look at those records very carefully and determine whether or not their insulin needs to be adjusted. So we have these people fill these out shortly after diagnosis when they're ready, and then periodically if things, when they return to clinic or during other times when it looks like they're needing a change in insulin, but we can't really quite figure out where to go.
So what is hypoglycemia?
So hypoglycemia is low blood sugar, and it's caused by a number of things. Certainly too much insulin would always cause hypoglycemia. Eating a meal that doesn't contain enough carbohydrates, so say your eyes are bigger than your stomach, for example, and you didn't eat everything that you thought you would. Drinking alcohol on an empty stomach without eating anything can also lead to hypoglycemia. More exercise than usual can lead to low blood sugar. And waiting too long to eat after the meal dose of insulin is given. So let's say you take your shot and the phone rings and you are distracted for half an hour. Well, it might get low, so it's a good idea to tell that person you'll call them back.
And so how can someone prevent hypoglycemia?
Yep. So there are a number of ways. Certainly, if you are going to be physically active, either in structured exercise or something that's unplanned, it's a good idea to eat some extra carbohydrate to prevent low blood sugars, because exercise makes your muscle cells more sensitive to your insulin, so your blood sugar is going to be burned up more quickly. Don't drink alcohol without food on an empty stomach. If you should become hypoglycemic, you need to treat it right away. Don't delay, because it isn't going to get any better without treatment. Never leave home without your blood sugar meter and a source of carbohydrates. So in your car, in your purse, in your pocket, in your bag, always carry some source of carbohydrates with you. If you have too many episodes or too frequent episodes of low blood sugar, probably your insulin needs to be adjusted. So you need to call your health provider then and discuss that. And another way to prevent hypoglycemia is to always test blood sugar before you go to bed. So particularly if you've had an active day, or if you've been, if you had a couple of drinks, or again, just to be on the safe side, we always recommend that people test their blood sugar before bedtime.
So what are the symptoms of hypoglycemia?
So symptoms will vary between one person to the next. You may get 1 or 2 of these symptoms. You may get more than that, and you may get a different symptom on a different occasion. But most commonly, people may feel a little sweaty, dizzy, They may get a little shaky, or they may get a little bit of irritability. They may get suddenly hungry. Some people may get a headache. They may feel a little weak or fatigued. They may feel anxious. Those are the most common signs of hypoglycemia or low blood sugar.
And then treatment for hypoglycemia.
So treatment, you should, if possible, you should always test your blood sugar. And if it's 70 or less, you're low. You can also have those symptoms if you're dropping quickly. So if you're less than 100 and dropping, you could feel low. So always test. If you are over 50 but low, 15 grams of simple carbohydrate that doesn't require enzymes is necessary for treatment. If you're less than 50, then we want you to double that. So I have 30 grams of carbohydrate. So easy examples of 15 grams of carbohydrate would be a half a cup of regular juice or soda or a cup of milk, for example. You got to wait 15 minutes. It takes that long for it to get into your bloodstream. And then we'd like you to retest your blood sugar. If you're still low, you need to do another round. So eat another 15 grams of carbohydrate or 30, depending upon when your blood sugar is, until it's over 70. Also, people who take insulin need to have a glucagon emergency kit, and that is something that, again, you can ask your healthcare provider about if you don't have one.
What is a glucagon emergency kit?
So glucagon is another hormone that's produced by the pancreas that if a person is unable to treat themselves, so that if they should become confused or if they should lose consciousness or unable to swallow, then someone else would need to administer that to you. And what it does is it stimulates your liver to release its stores of sugar, so it will bring you out of that low blood sugar.
Okay, well, that's good to know. You've mentioned a couple of times about low blood sugars and alcohol. Talk a little bit more about that, please.
Yep. So alcohol, again, lowers blood sugar, but actually it can increase blood sugar too. But most commonly, it probably can lower blood sugar if you drink on an empty stomach. And this is when we talk about pure alcohol. So whether it's hard liquor mixed with, say, a diet beverage, not a sweet beverage, or wine or even beer. I've seen people many times get low on alcohol when they're not eating or if they haven't eaten for several hours. And the reason for this is because alcohol suppresses your own liver's output of sugar. So if you've got insulin on board, alcohol by itself, pure alcohol, does not break down during digestion to sugar. So you've got your insulin that you've already taken, and now you're drinking alcohol, which is prohibiting your liver from releasing sugar. So you really have no source of sugar. So it will cause you to drop, particularly if you're active, if you're dancing or if you're playing sports. So in order to prevent this, always drink alcohol with food. Never drink on an empty stomach. And it should be food that contains carbohydrates. Don't take insulin for alcohol, for pure alcohol. You should always wear diabetes identification. So if you should pass out or become confused, people who are coming to help you would know that you have diabetes. And always you should check your blood sugar. Again, different circumstances, different types of beverages, whether or not they're sweet or not, may raise blood sugar.
Right.
So, but in any case, in the end, if the more you drink, the lower you may go later on. So it's really important to just be careful and test your blood sugar to see how alcohol affects you. And then you should also talk to your doctor because there are certain people who shouldn't drink alcohol. Certain medications may interact with alcohol, and if you have CF liver disease, obviously that would be a contraindication as well.
So let's switch a little bit to an exercise perspective. Can a person with CF-related diabetes no longer need insulin because they're active and exercising?
No. So
That's
again,
simple.
Yep. The main defect in cystic fibrosis-related diabetes, as Dr. Moran was saying, is that it's underlying insulin deficiency. So, and that's an easy question to be confused about because people with type 2 diabetes, which is the most common type of diabetes in this country, may be able to, if they exercise enough and lose weight, they may be able to get off their medication. But it's not true with CFRD once you're on insulin. Exercise does, again, sensitize your muscle cells to insulin because it needs more sugar for energy. So you may need less insulin, but you're not going to be able to get off insulin. So blood sugar, again, will vary depending upon the type of exercise you do, the intensity, or how hard you work, and the length of your exercise session. So again, you want to check your blood sugar before, during, and after starting a new exercise regimen to see how this particular type of activity affects you. You may find that your blood sugars differ when you play baseball and may be doing a certain amount of standing around versus basketball or jogging, some type of more aerobically intense exercise. So you always should carry extra carbohydrate when you exercise in case you get lower to prevent low blood sugar. And you may also need to eat additional extra or free carbohydrates without insulin later on in the day to prevent low blood sugars later, particularly if it's been a pretty intense or longer duration exercise. So in this little table here, there's just some general rule of thumbs, general rule of thumb that a person can follow to prevent low blood sugars with any type of physical activity. So the general rule of thumb is you'll need 15 to 30 grams of carbohydrate for every hour of continuous physical activity to prevent low blood sugars when active. So the longer you exercise or the more intense you exercise, the more carbohydrates you may need. So for example, high intensity for 60 minutes or more, a person may need 30 to as much as 50 grams of carbohydrate every hour. So it really depends. So the only way you're going to know this is to test. You have to start somewhere and then test and to figure out what works for you.
So is there I know people who do intensive exercise activity, bike riding, long-term swimming, they tend to do carbohydrate loading, those who don't have diabetes or CF.
Right.
How does that play into somebody who has CF-related diabetes who's going to do a long bike ride or a triathlon? Should they carbo load, or they just need to stop and follow like your chart and about every hour make sure they take in?
Well, for those people who are really very good athletes, they really should sit down with their diabetes team and their doctor and discuss that, because I have worked with people with type 1 diabetes, for example, and type 2 that do these types of activities, and everybody's different, and I would think that would be true for CF as well. But number one, you need to be very well nourished, and you need to have adequate stores of glucose or glycogen from carbohydrate and healthy nutritional status, good nutritional status. So you certainly can't attempt to do these activities if your nutritional status is not the best. But yes, you do need extra carbohydrates before and during, but you are going to need to stop and test your blood sugar to see where you're at.
Quite frequently,
along the way.
I would think. So this question came in live, and that is it okay to give my child insulin after they've eaten and I know exactly how many carbohydrates they've eaten?
Yes, we do. I'll let Dr. Moran talk about that.
So insulin is always better if you give it before you eat. It works better if the insulin levels are rising at the same time as the food's being absorbed from your stomach. But there are some situations where we do give it after someone eats. If you truly have no idea how much someone is going to eat, then you can give it afterwards. So for example, infants, toddlers with diabetes, we always give the insulin after they eat because we just don't know how much they're going to eat.
Right.
If someone is ill and just not quite sure how much food they're going to be able to handle, or young children where you really can't predict. If they are on an insulin pump, so you're not giving multiple injections, it's easier because you can give them a little bit of insulin before they eat and then a little bit more to make up the difference. So I guess the answer to the question is, yes, it's okay. It's usually not the first choice, but sometimes it's the practical choice.
Well, do you have any advice or tips for people who are managing CF-related diabetes on a daily, for their daily management?
CFRD is just part of CF. It's a deficiency just like the vitamin deficiency, like the enzyme deficiency. It's just replacing something that your body needs, but it shouldn't dominate your life. It shouldn't be a huge burden. You shouldn't have to change your lifestyle. Work with your diabetes team, and we can help incorporate the diabetes into your lifestyle.
So just some couple last questions. I know we talked about this earlier in this broadcast, but just for clarification, is there anything people can do to prevent from getting CF-related diabetes, like not eat as many sweets or exercise more?
Nothing. The scarring that takes place in your pancreas is totally independent of what you're eating, how you're exercising. There is nothing you can do to prevent diabetes. So live a healthy life, eat the food you like, get good exercise because it's the healthy thing to do, but not because it'll stop you from getting diabetes.
Okay, so 2 last questions, kind of on the same perspective. If there is a cure for cystic fibrosis, will that mean a cure for CF-related diabetes? And how do these new drugs, the VX770, VX809, how might that affect CF-related diabetes?
This is a really interesting question that nobody knows the answer to. We know that the CFTR channel is present in the cells that make insulin. If we fix that channel, could we prevent diabetes? We are just now talking about studies to look at that.
So that's great. And thank you, Tony, and thank you, Carol. This has been a wonderful discussion about CF-related diabetes and what people should know. You can read some of the frequently asked questions about CF-related diabetes on the Foundation's website under Living with Cystic Fibrosis, Staying Healthy, and click on CFRD. This is also where you can find the instructional manual about how to manage CF-related diabetes. You can also read the CF Care Guidelines for Cystic Fibrosis-related diabetes in the treatment section under CF Care Guidelines. Click on Nutrition/GI, and then you can read what is recommended for CFRD care. To learn more about type 1 and type 2 diabetes, you can go to the American Diabetes Association website at www.diabetes.org and click on Diabetes Basic. Also, this is where Carol said you'd be able to find your diabetes ID. This concludes our virtual CF Education Day webcast about CF-related diabetes. I would like to thank you for watching, Tony and Carol for answering the questions that we had come in, Rick Vasta and the technical crew, Melissa Chin, Genentech, and the Cystic Fibrosis Foundation for making this webcast possible. Thank you very much.